Jim Del Rosso here in beautiful Kauai. It's absolutely beautiful here. But I'm here to talk about what's new in the medicine chest. In part one, I cover topical therapies. In part two, I cover systemic therapies. And within part two, I talk about some oral agents, oral antibiotics, oral anti-inflammatory doses, a sub-antibiotic dose doxycycline, which now has data, the 40 milligram modified release once a day of doxycycline, which is sub-antibiotic, has data to show in and of itself without topical therapy in patients with papulopustular rosacea reducing relapses. We also have data on oral sarecycline, which is approved for acne. We have the pilot study, which was a large study that I and others, Zoe Draelos and others, have published in the Journal of Drugs and Dermatology earlier this year for papulopustular rosacea. Very impressive results and excellent safety. There's also new information on a low-dose extended-release minocycline, which is not proven to be sub-antibiotic, but it might be if we get further data to show that, but it is a lower dose. 40 milligrams once a day was shown to be effective for papulopustular rosacea and was actually shown in one particular phase 2 study, though we need more data, to have better results in reducing papulopustular lesions than the 40 milligram once daily doxycycline, at least in that preliminary study. And then moving on, we have tralokinumab, which is an anti-IL-13 monoclonal antibody, FDA approved for moderate to severe atopic dermatitis, impressive data with inhibition of IL-13. And then going on to some other agents, the oral Janus kinase inhibitors for atopic dermatitis that is sitting with the FDA, abrocitinib, upadacitinib, and baricitinib, all have been shown to be very effective with a rapid reduction in itch. Some issues regarding monitoring for safety. Overall, they've been very safe, but there are some things we need to look for. We'll be discussing that. We're waiting on FDA approval. So that sums it up. We'll go into more detail in the presentations. I can't give away the ranch right now, but certainly I think you'll find it to be very informative.